Hello everyone. So in this video I am going to tell you about the thiazide like diuretics. So first of all, these thiazides act on the distal part, acts on distal tubules. So these acts on distal tubules, and also how they will act on the distal tubules. So there is a symport, that is a sodium chloride symport, so in which sodium and chloride symport is there. So thiazide act on these channels and it inhibits the sodium chloride symport. So its mechanism of thiazide is it inhibits sodium chloride symport. So if there is no reabsorption of sodium and chloride, it means that sodium is loses in the urine, that is natriuresis is there. So the side effects of the thiazide, so first of all I am going to tell you about the side effects. So in the side effects of thiazide, there is decrease of sodium in the blood, there is decrease of potassium in the blood, there is decrease of magnesium in the blood, and there is also decrease of hydrogen in the blood. And also the side effect that it increase the glucose in blood, means hyperglycemia, it lead to hyperglycemia, and it leads to the hyperuricemia because it increase the uric acid in our blood, and it also increase the lipids in our blood. So these were the side effects of the thiazide. Because it loses the sodium and chloride, so natriuresis will be there, and there is hyponatremia in the blood. So these were the side effects. Now what were the thiazide drugs? So drugs were like, they have the ending thiazide. So these were methiazide, polythiazide, polythiazide, chlorothiazide, indapamide, and zipamide. These were the thiazide like diuretics, and indapamide and these zipamides, these are thiazide like diuretics. And I already told you about the side effects because it loses the sodium, so there is hyponatremia in the blood. Now there is one important point as the loop diuretics. So the loop diuretics loses the calcium, so loop diuretics, or we can say loop loses the calcium. So in that condition there is decrease of calcium, while in the thiazide it increases the calcium. So here it is used in the treatment of osteoporosis, while in that condition it is used in the treatment of hypercalcemia. So this is the important point. Please remember that loop diuretics used in the treatment of hypercalcemia, while the thiazides used in the treatment of osteoporosis. Now there is one question, that which diuretics is used in the treatment of renal stones. So for that also we have the answer, that thiazide is used in is the only diuretics which is used in the treatment of renal stones, And after that there is like, because thiazide it increases the serum calcium level. When the calcium level is increased in the serum, it means that calcium reaches to the kidneys very less. In that way it prevents the renal stones. Now what were the uses of thiazides? So here important, that is uses of thiazides. So for the uses of thiazides, we have to remember that it is the drug of choice. It is the drug of choice in hypertension, condition, because it decreases the sodium and chloride. That's why it is the drug of choice in the hypertension conditions, and it is also used in the edema condition, in the recurrent renal calcium stones. It is used in the recurrent calcium stones, and it is also used in the bromide and iodide poisoning, and also it is used in the osteoporosis because it increases the calcium level. So in the treatment of osteoporosis it is used, and also it is used in the diabetes insipidus, conditions also thiazides. So these all were the uses. The first one is it is a drug of choice in the hypertension condition, in the edema, in the renal calcium stones, recurrent calcium stones, it is the treatment, and in the bromide iodide poisoning, osteoporosis, and diabetes insipidus condition it is useful. Now mainly in the diabetes insipidus, in the nephrogenic diabetes insipidus, in nephrogenic diabetes insipidus, it is useful in the nephrogenic diabetes insipidus condition. For the central diabetes insipidus condition, it is used in the treatment of. So for the central diabetes insipidus, the treatment is desmopressin. While for the nephrogenic diabetes insipidus, the treatment is the drug of choice. We can say the drug of choice is Thiazides. So that's all for the thiazide diuretics. I hope this video is useful for you. Thank you. Bye bye guys.